Well, welcome to Anderson Hall this afternoon. I'm Ginny Stimson, and I'm the co-chair of the Low Vision Hearing Challenge Committee. And we're happy to have Jo Munson back with us. She gave a talk for us during COVID on Zoom, but here she is in person. Jo is an audiologist who has a private practice in West Seattle, but she comes to Horizon House on Fridays, on the first and third Friday each week. Well, each month, I guess, first and third Friday each month, to help people with their hearing issues here. But today she's come to answer our questions. So many things are changing now with hearing devices because you can buy these over-the-counter devices. Still, people go to audiologists and get devices that way. What we've heard on our committee is how much the price of these devices has gone down recently, and then how much insurance has increased to support those. So with those changes, then people are saying, okay, so what we hear, and Jo's going to answer, but we hear people say there's T-coil in this room and in the Myrtle Edwards room, the Robert Durham room, and the Sky Lounge. How do I know if my hearing aid supports T-coil, and how do I turn that darn thing on? And then people have talked about now with having trouble hearing their TVs, that you can get TVs that have Bluetooth that hooks to your hearing aid. So there's a question of, should I look for that? So we thought it would be terrific to have Jo come and share with us, what are the changes that are happening? How do I know what kind of device to buy? And she has arranged for somebody to do childcare for her this afternoon. So she said she will talk for a while, and then we'll take questions, and she'll stick around if you have more questions. So thank you so much for your generosity and making yourself available today, Jo. Right. Welcome. Thank you.
Check, check. All right, let's see if we can get the mic the same. Hi, everybody. It's so good to be back. I was speaking with Natalie about this room, which I've been in a few times, but boy, has it changed. This looks awesome. So you guys have a wonderful spot and wonderful committees that help you in these ways of being able to see presentations and hear them as well. So please don't be shy to correct me if my mic is not in the right spot. If you feel like I need to adjust, let me know. So 19 years ago, I walked through the doors of Horizon House. Back when we had our space for the health center over where the admin center is. I looked a little bit different, maybe. No comments, please. But what a great time. We've continued our twice a month plan here at Horizon House. That is not true. I used to have about 45 on my schedule, plus 2 offices. We're down to about 17 that we service on a regular basis, none of which I do as a frequency as I do Horizon House. And that is partially due to your staff here, your availability of where I get to practice and see the residents here. So kudos to, again, Horizon House for making something as important as hearing care available to you. And I'm thrilled to be a part of that. So thank you, Horizon House, for being there for me, for us sharing that together. Jeannie mentioned to me something that came up before we get started. There's been a lot of questions surrounding T-coils and how they work and when they work and what are they for. A T-coil, I did give a talk on this maybe 7 years ago, 6 years ago. Do you remember T-coil? No. T-coils are amazing. They've been around for decades. What does it do? It's an electromagnetic signal from a production speaker, stereo, etc., that we can transmit into a hearing aid by way of a telecoil. That a telecoil connects with a phone, that's true, but we can use this T-coil to connect to a speaker system like I am now, and some of you are hearing me through a loop. So there is a wired system in this room that connects to the stereo output that then connects to what you're listening to. Not all hearing aids Yes. Oh, are you videotaping? I'm so sorry. This area is where I need to stay. I'm a roamer. um, you want the lights back on? That's a request. It depends on their filming, I suppose, but that is sort of a request if we hear that. A T-coil, do I look worse or better with the lights? Okay. We might need to turn them down again. A T-coil works with many hearing aids at once. That's the big benefit about it. So if someone has brand A and somebody else has brand B and they both have a T-coil, it doesn't matter. So it's not proprietary to that one person's hearing aids like a child's FM system is connected. The teacher can speak to multiple students in the room. So is the T-coil in your hearing aids if you have them. Not all hearing aids do. And are they turned on? And how are they set? All of that matters and how it connects to this system. Why is it wonderful? It removes distance from the speaker system to your ear. We call that direct audio input. So as this system has volume power through the speakers, it kind of doesn't matter if the speaker is low or high or you're far from it. What matters is my voice going from my system to your system, the T-coil in your hearing aid. Does that make sense? So many of you might go, oh, I don't know if I have a T-coil. The best thing I can tell you is please call your provider and say, do I have a T-coil? I need it to be set up, because it is a fabulous tool to use. Again, not every hearing aid has one. It's sometimes space regulated on what all can be fit in there. And sometimes it's just needing to be turned on. So hopefully that answers some of y'all's questions about T-coils. I love the topic. Please reach out to me. There is a website called Loop Seattle that's a great resource for a lot of community buildings, banks, and theaters that have loops as well for you to hear through. All right, well, let's get started. This is the biggest crowd. We also have a lot more people at Horizon House. The topic of over-the-counter products. It pains me to call it hearing aids, but I will, an OTC hearing aid. What is it, and is it right for me? We're going to go through that series together today. Should have put these in different order. That's me. We do have 2 locations, one in Seattle, West Seattle, one in Renton. I've been coming here since 2005. Again, I love the relationship that I have at Horizon House, and I do see many of the retirement communities around Seattle proper as well. So thank you again for letting me be here. I'm going to skip a few of these. I put this up here because, why do I think I'm important? An audiologist goes to school alongside a podiatrist, alongside an optometrist. We're in the same schooling scenario. So those are like specialties for sight, for feet and ears. We're kind of all together. And physical therapy is in that same schooling group, all of which have to have a doctorate now, including physical therapy. There are still some existing audiologists that don't have a doctorate. They simply have a master's degree. But it's primarily an education based on diagnosing hearing loss, how do we hear, how do we treat it, identifying diseases, tinnitus, etc. So it's very specialized on the ear anatomy and how that's supposed to work on humans. Why is it such a big deal? It's so prevalent. A lot of people think, oh, I didn't get hearing loss until last year. Well, that potentially could be true. However, the data shows us otherwise. We typically start losing our hearing in our late 40s and early 50s. A little bit every year. And I say it's kind of like gray hair. It sneaks up on you. And then you see a picture and you go, oh, wow, I used to not have all white head like I do. But it's very slow. We don't recognize it. So 5, 7, 10, 15 years go by, and then we go, oh, maybe I should get a hearing test. But it's very prevalent. It's actually the third most prevalent issue, disease, common chronic physical condition in the United States. It's twice as prevalent as diabetes. That was a shocker. It's a lot. So a lot of us have hearing loss. It does increase as we get older, of course, because those little hair cells just kind of wear out after the sound has bombarded it for so long. Certainly things make it worse, like noise exposure, some medications, head traumas, things like that. But it's so prevalent. So it's something we have known about for a while, something that has recently come to light that I think more and more health professionals are paying attention to it. And if your doctor does the little key test that if you have hearing loss or not, please tell them to read some literature and hand you a card to go somewhere to get a hearing test. The key test is a little bit outdated, okay? So I usually tell people if we're recognizing that in our 40s and 50s and 60s, we should go get a hearing test, much like we do an eye test. Okay, so we talked a little bit about that. Hearing loss is super important. We all know about the American Medical Association report that came out of the list of unfortunately negative things that increase when we have hearing loss. We're more likely to have cognitive decline, even with mild hearing loss. It's up 30 to 40%. Increase in dementia, increase in fall rate, social isolation and depression, of course, is all increased when we're suffering from hearing loss that's not treated. Balance included, yes. Balance included. Our balance mechanism is in our inner ear. Balance is also dealt with vision and proprioceptive response. So it's a little combination, but certainly can be balance as well. So yes, the 7-year mark, I thought that maybe COVID had bumped up the age a little bit as I was tracking how young my patients were, and that's still true, just not as much as I thought, because we were wearing the masks, and those of you that lip read, that feel like you don't have hearing problems, but all of a sudden people started mumbling, that brought a lot more customers in the door because we were aware of it. So awareness is a big key. It's what I'm just sharing with people. Encourage people to have their hearing tested. It has a lot to do with our overall health, stimulating our central nervous system. How the ear communicates with the brain is super important, especially when you look at some of these effects of hearing loss. Agreed? What do we do if we think we have hearing loss? A lot of you have been preached this before. The first thing you really should do is have a hearing test. It's not that complicated. It's super simple. Call an office. They might be 2 weeks out or something. That's okay. You've waited 24 years. And so go ahead and wait 2 more weeks. Get on the schedule. Go in. Tell them what's going on. Have your hearing tested to look at the result. Take a friend. Take a family member so you feel comfortable. A lot of people are like, well, I'm afraid they're going to try and sell me something. If your doctor told you you had diabetes, would you take some medication if you thought it would help you? Yes. If your eye doctor said you're blind as a bat, would you wear glasses? Maybe, maybe not. It's kind of the same. Not all audiologists may be as blatantly honest as maybe I am, but if you have an issue, I'm going to tell you about it. Whether or not you want to do something about it, the decision is still in your hand. But at least get the hearing test and get it documented. You can stow it away if you want. Try not to wait that 7 years again, right? We keep adding on to those 7 years. All right, OTCs, what has changed? So in 2017, they passed the bipartisan decision to say we're going to have over-the-counter hearing aids. they're going to create a category. It took them a while to figure out what that category looked like, back and forth with a lot of hearing aid manufacturers, a lot of physicians and audiologists to say, what does this look like? I want to point out, though, this bottom paragraph. It's important to know, is this the top button? There we go. It's important to know that we've had internet hearing aids before. For those of you that have been on the internet, we've had them before. A lot of what's out there is not anything new. They might call it something different. But as an amplifier, internet, now hearing aid, it seems like, oh my gosh, Joe, your hearing aids are now at Best Buy. And that is the furthest thing from the truth. They are not. And I don't think they ever will be. I could be proven wrong, but I think if that's the case, it's going to be 30 years from now. But for now, there are over-the-counter products. What are they? What do they look like? Are they as good as the advertisements say? And you all know, hopefully my patients, I told you that a hearing aid is a wonderful tool, very sophisticated, but it doesn't bring back your normal hearing, right? Even as good as I think I can make it. Your natural ear is your best ear. So read those marketing tools with a thought in your head that go, wait a minute, these people get paid for me to read this and go to the store, okay? Anybody ever see the ad that said, buy one, get one free? Really? Okay. So just think about that when you guys are reading those. Okay, so what's going on out there? So hearing loss, as we know, is a huge industry. 40 million Americans suffer from hearing loss. It's a treatment that is largely not, let me say this. It is an issue, a health issue, that only about 25% of Americans do something about. Now, I will say, I wish I could say I had a twin that was 30 years ago when I started, 35 years ago, that when I started back then, we also thought that those $800-900 hearing aids were too much. Digital came along and our pricing went to like $2,000. This was back in the late 80s, early 90s, mind you. And we thought, well, this is why only 25% of the people are wearing hearing aids. So a handful of people in the industry made some cheap products. We sold them for $6.99. And guess how much that needle moved from 25% of the people in the industry that needed hearing aids? Did it change it? No, it didn't. So it wasn't necessarily, at least back then, that the price was the objection. So was it education? Was it people were stubborn? Was it they just didn't want to do it? Was it price? I don't know. But what I do know is that didn't move the needle of how many people needed hearing aids, got them. No more people got them when that new price product came out. That might not be the case now. I don't know. We'll see. Only time will tell. A lot of people early on, because there's so much potential to reach a lot of people, got in the market. Bose and Apple got in the market before it even was legal, and they started building their products. Guess who's already out of the market? Bose and Apple. Are they not good companies? Bose is pretty good stereo. Who has a Bose? All right. Good sound quality. Sounds great. They couldn't make a hearing aid. Does that shock you? They got out. They couldn't meet their numbers. There's an article. I should have if you want it, I'll get it for you. They didn't meet their numbers. They didn't sell what they thought they could sell. They couldn't produce the circuit, the chip. They ended up selling their rights to what they created to another company, because it wasn't what they wanted to do. Now, if Bose isn't in the sound system and doesn't know what they're supposed to do with hearing aids, who is? Well, there's been some companies out there for 50, 60 years manufacturing hearing aids. They might know a thing or two, And that might be a reason of why there is a cost point to them. And somebody asked me about cost. I will be as wide open as I can about costs towards the end when you ask questions. These are some of the main companies that are out: Oticon, Starkey, Signia, Phonak, GN Resound. Those have been manufacturing companies that I have used for 35 years. They're not going anywhere. They've bought other companies. They're big name brand companies. They employ uber smart engineers. They pull from different companies, from Amazon, from Microsoft, from Apple, to come in and help them create something that's better, that sounds like a normal ear, which we know we can't attain. But they dream up these crazy thoughts of how we can help somebody hear better. Is everybody hearing me okay, by the way? Good. It is shocking, though, when I look at these big companies, you know, the price tag of earbuds. Everybody has earbuds for like $10. I do. Did you know there's some out there for $55,000? What's in them? No, there was a gold one. I saw a platinum, and that was $4 million. Not earbuds, it was a speaker for $4 million. But that's something you just take and plug into a sound source. So certainly, they're building something that has a value there for somehow. Do you think that $55,000 piece is the same as the $12 ones that I have? Probably not. Same for speakers. I mean, you can buy a speaker that sits on your desk for $500,000. Better sound pretty good. I won't have one, but anyway, it's all up to what the technology is. And in the medical world, you have to prove that stuff. When it's FDA approved, which is different from FDA regulated. Keep that in mind. I'm jumping around. Am I seeing? Did I skip that one? Did I do that twice? There we go. All right, so I'm overlapping. What is the big difference? I still need to stay here, right? I'm overlapping the difference with OTCs and prescription hearing aids. I said just a few moments ago, they are not the same. So for those of you who are my patients, the product that you get, you are not going to see them over the counter. They are not the same. Here's the overlay. So we have at the top there OTC hearing aids. That's kind of light. Can we make that fatter? The light. Can everybody see up there? Talking on this side. OTC hearing aids. What is the difference? Well, an OTC you fit by yourself. You don't have an audiologist. You haven't had a hearing test. Your perceived hearing loss, I'm not hearing quite as well as I think I should. As opposed to the other side, the prescription hearing aids. Okay, so very similar if I bring an analogy out of prescription eyeglasses to readers. It's kind of similar here, right? The doctor said you needed trifocals, and you said, I'm not paying for that. I'm going to go get some readers at Bartell's. Similar. Not the exact same, but similar. Huh? That's right. Isn't it true? They still have the name up, though. Still says Bartell's. Here. This one is. They still have one in my town. All right. Another huge difference, which is what brought all these new companies to the market, what has brought everybody's attention to say, well, why would I get an average of $5,000 pair hearing aids with an audiologist when I can go and buy a pair of over-the-counter hearing aids for $1,000? Now, I know there are over-the-counter hearing aids that are $199, and please trust me, that's the same newspaper ad that you have seen for the last 20 years. It is not. Is something better than nothing? Yes, I would say that. Is Advil, if you need surgery, going to help you for your, stomach pain? Maybe, but you need surgery, right? Some sound is going to help you communicate with your loved ones, and I agree with that. However, is it treatment for your hearing loss? It is not. But you can grab a pair of those for, $700. Some of those, I've seen a couple in the $900 range that I thought were okay. You cannot get them if you're 18. Why is that? Why do we think that is? Yes, if you're under 18, you cannot get over-the-counter hearing aids. Why do we think that is? Maybe it's not safe. Maybe we value under 18-year-old hearing better than we do yours. Something to think about. You can't. Partially that's because an 18-year-old really can't make great decisions. We all know that. But you cannot do that if you're 18. It's for 18 and over. It is for hearing loss perception. Okay? Not diagnosed hearing loss. It is for mild to moderate. I have some papers up there. Mild is 0 to 25 decibels, and moderate is 25 to 40 decibels. I'm sorry, I said that wrong. 0 to 25 is normal to, I was just forgetting one of my levels of hearing loss. Slight, thank you, slight hearing loss. Mild is 25 to 40. Okay? So up to 40. This is designed by one-fits-all size without prescription. Customized prescription hearing aids are both prescribed with a prescription like a eyeglass prescription, as well as customized fit sometimes with ear molds or custom in-the-ear hearing aids. Right now there's no proposal for the return policy. There's no verification testing. We certainly don't recommend those for people that have moderate to severe hearing loss or severe to profound. And the selection process is your Best Buy attendant. It's not whomever is there on staff, which they do not regulate their training either. So a little bit of difference there. There's some lap over in cost, and that's really about it. Yes, there are prescribed hearing aids out there less than $1,000, not a lot. Some of that depends on area of the country of what someone's charging, your provider, etc. But that's each, though. You can get a single, very entry-level hearing aid right now for generally around $900. So not too expensive. Any questions? What I was saying was that there was some overlap in cost. Let me go on the next screen. I think I have some general screens. Overlap in cost where OTC hearing devices notably less, right? You got the $199 things. Some good ones are like $900, and I was just saying that prescription hearing aids from an audiologist, we do have access to some entry-level devices. Whether or not they're appropriate for you, just like a monocle might not be appropriate for your diagnosis of, I need a trifocal. Some of my patients recognize when I'm counseling, I say 3 things that helps you make a decision. The first is your diagnosis of your hearing loss, what the audiologist thinks you need to help your prescription. The second is your budget, and the third, your goal. What are your goals for hearing? You just want to hear in a quiet place, or do you live an active life and you need your hearing aid to work more? And those 3 things help funnel you to make a good decision. And again, that's definitely why in that screen it's not one size fits all, especially in the prescription, right? All right, so this is just a little screen for us to say, you know, what is my hearing like? How do I know I have hearing loss? Much of the same when you say huh a lot, or you turn the TV up, you have trouble in noise. It's a very generic way to say my difficulty might match my degree of hearing loss. However, I want you guys to know that average speech, did any of you grab this? Okay. average speech is in the middle of the scale. So if you're gauging how you hear other people as your degree of loss, it's like you've lost half your hearing if you're starting to have trouble with speech. It's kind of like saying, I can see you perfectly well right now, so I don't have vision problems. Right? It's the same with your ears, because speech is a loud signal, moderately loud. So when we start to have difficulty with speech, it's almost like we're down the scale a bit. So keep that in mind. And then all of those other environmental sounds that we may not want to hear, like traffic or paper rustling or a horn honking or a dog barking, those are actually signals for our hearing and our brain that keep that pathway healthy. As much as we don't want to hear noise, noise is part of life, and it actually is healthy. It stimulates our central nervous system and that part of our brain where the auditory nerve touches the cortex. Okay? All right, the pros of over-the-counter hearing aids. There are pros. I think getting people to acknowledge their hearing loss sooner is a big pro. I think it's huge. For people just dabbling and saying, hey, I'm just trying to put my foot in the water and see what's going on there. And yeah, I recognize I need help to get started. Do I still think it's a treatment? No, I don't. But it's a start for people that, again, are starting to dabble. It's very accessible. You can go to, a lot of stores and get an over-the-counter something, right? I do feel bad because I've had a numerous amount of people that have spent $400 or $500 on internet hearing aids, and then they come in and go, these don't work, and they can't give them back. Do many of you know that have hearing aids know that in the state of Washington, when you buy hearing aids, you have to have a trial period? You have to. It's regulated. We can charge office visit fees and return stocking fees, but it's like $300. But you can return them. You're not out for, the full amount of hearing devices. So affordability is good. Accessibility is great. And again, it's good for people getting their feet wet with mild hearing loss. Okay? The cons, I feel like the majority of our population that is starting to wear hearing aids does need support. I think being able to diagnose and support somebody's hearing loss is the most basic part of being successful with hearing treatment. The consequence of not treating your hearing loss should be not acceptable to any of you guys, because it's not good. It's all negative, except you sleep better when you don't hear. Prescription devices. These are medical grade devices, right? They're class 3 medical grade devices that can only be handled by professionals. And that's why I was telling you, they're not the same. They're not the same. There was a major name change of PSAPs. Does anybody remember PSAPs? It's just an amplifier device to allow them to call them hearing aids, very similarly to the readers being called eyeglasses. Very similar. And then lastly, the con is those main manufacturers. They spend hundreds of millions of dollars on research and design to create real products, as opposed to putting a speaker and a microphone together. Again, the analogy of different speakers, different earbuds, all of those are made differently. Hence, they have a different price tag. You guys know I pay for some devices several $1,000s, my cost. Is that shocking? It's a lot. It's a lot. So over the decades, things have gotten better, and the price has reflected that. It makes sense. But Will those manufacturers bring their costs down? Not if they're going to keep making better hearing aids. They won't, because they spend so much on their product line. It's possible. I think we're in for a lot of changes. We're going to talk about some of those. If you're in the market for an OTC, an over-the-counter hearing aid, and you go, hey, I just want to try them out, here are some red flags that you need to say, I need to go to an audiologist. I need to be referred. You can't go if you're under 18. That's not any of us. If you hear better in one ear, so you're asymmetrical, you should go to an audiologist. I don't know if these questions are going to be when you go over to the counter at Best Buy and buy hearing aids, but it should be. Do you have sudden hearing loss in the last 6 months? Do you have any ringing or tinnitus? Tinnitus can be a byproduct of a lot of things that needs to be checked out. Do you have a history of taking medications? A lot of the cancer treatments have hearing loss as a consequence. History of chemotherapy and radiation as well. Have you noticed any drainage of your ear? Have you had ear infections? Do you have constant pain? Or if you have dizziness? These are all reasons you should go to an audiologist, or you should be referred to your ear, nose, and throat physician. You can get them anywhere. You can go to local pharmacies. You can go to drugstores. Some grocery stores have them, large retail chains. It is important to read all of that information on the box. As far as you're returning it, I strongly suggest you reach out to your senators to say what are these rules and who's going to uphold them. Has anybody bought one that had to return it? Anyone? Okay. There are some audiologists that will offer some service to these products. I'm not there yet. I am contemplating it as part of our routine. Maybe, maybe not. But there are some around, probably not like Virginia Mason or an organization like Polyclinic would not do that. For time and expenses, you're spending money for the office visit, you'll be paying for, all of those things that are right now bundled inside the cost of hearing aids. We're going to talk about that. I took some things out of this slide. How is insurance involved with if you're going to buy an OTC? You guys, 2024 hit, and because of some very good lobbying and one little young man's testimony, the state of Washington adopted that if you're on a big insurance plan, they are mandated, a big group insurance plan, meaning over 100 employees, they're mandated to give you a $5,000 policy for hearing aids, which is wonderful, wonderfully amazing. Whether or not any of your other insurances will cover over the counter, I don't know. That angers me, and it should you too. That the group of people that are working, and yes, they should be doing it for these people too, but for our retired people and seniors, what do we get? Right? You get sent to the over-the-counter grocery store. So my audiology group is like, wait a minute. We kind of got this a little bit backwards. We're retired. We have set incomes and et cetera, et cetera. Why are we not assisting our senior groups? I think the insurance companies had a lot to do with over-the-counter. And again, I feel like sometimes that's good, sometimes it's not. Insurances are changing the way we work. Again, I'm going into the money piece because I think you guys, it's good for you to know. There is a major insurance company that many of you have that asks me to see you for free, to test you for free without reimbursement. Now, that's a great perk for you, right? A lot of those types of insurances have been dropped. None of my local colleagues currently take them. I only take one more right now that works like that. But it's not sustainable, I guess is what I'm saying. So my urge, again, is we still got to talk to our senators. I think OTC is a step. I think the insurance for the younger working population is a big step. We need to go another step, right? Other people need hearing aids as well. Our largest population of people that need help is where? It's right here, right? And I'm trying to encourage all of my colleagues as well to be on that train. We got to keep going. We got to keep working at it. We are starting to unbundle our services. What does that mean? It means typically in the state of Washington, when you've bought a very expensive hearing aid, let's say you went to Virginia Mason, you came to me, you spent $5,000. Typically that means we're taking care of you during the interim of the next 3 to 5 years. You're coming in for your checkups. You're coming in for your re-prescription. Just a routine check and clean. Oops, I broke my hearing aid. Can you fix it? All of those things we're handling for you without you paying each time you come in. That's called bundling of services. Now, with over-the-counter products and people wanting to do things on their own, more and more audiologists are saying, okay, well, here's your $900 hearing aid. Thank you very much. Right? I've tested your hearing. I've done my part. You don't want my services to hold your hand. You don't need them. Right? So that's coming. I think it's evolving. How it turns out, I don't know. I haven't done it yet. I'm not to say that I won't this year or next year. It might be coming. But it's something to think about of, don't you bought your stuff here, you need some help, right? That's usually the way people feel, especially with big ticket items like a car, right? You want them to take care of you. Well, hearing aids has been the same way. So that's something to think about. I don't know how it's going to turn out. It's a brand new ruling. Things are going to change. So we just have to be watching that. We don't know how to handle returns. We don't know how to handle assistance. Where do you mail your hearing aid if it's broken, or you just go, oh, it's broken, I got to buy a new one for $300 or $400? I don't know. Different regulations and requirements from the state versus the FDA. And then are there any software firmware updates? Does that, I'm assuming you can't trade it in and get the update if something went out on your Bluetooth. Bluetooth doesn't last forever, especially when your phone upgrades. And you go, oh, we're on the old version. I bought this 3 years ago at Best Buy. I keep using Best Buy. I'm sorry. It's nothing against Best Buy. I shop at Best Buy. I'm just using it as an example. It could be Walmart. It could be Costco. It could be wherever. But then even on my hearing aids, sometimes I have to update the firmware because your phone's out of date, and we have to do that, and they have to do the hearing aid firmware update. So those things have to be in sync. We okay? Am I boring you guys? Okay. Yes, I heard a yes over there. When do we stop using them? Again, those cautions of when not to go. If you have drainage from the ear, do you have ear pain, are you having tinnitus? You should stop using your product. Okay, and see a doctor. See an audiologist, see your primary care physician, especially if you're dizzy. You see a shift in your hearing. Any kind of sudden hearing loss is a red flag. All right. All right. So I went through that pretty fast, didn't I? See what time it is. Oh, we're doing great. This is my office. Again, I'm in West Seattle. You can find us on the web. I think ultimately when you're treating your health care, some people have to have name brand prescription. Some people are okay with, what's the other word? Generic prescriptions. Some people go to Mexico for prescription. Canada. Some people use their friends, right? So you guys have to decide how you're going to treat your own health care. Clearly, I'm an audiologist. I think hearing is uber important. I've always said, do something. And if this is the something, great, do it. You should end up at my office later. But do something as opposed to waiting. The years that go by for people that don't do something on their hearing is really detrimental. A lot of things happen, just like if you had an abscessed tooth. If you don't treat it and you wait, it's a lot harder, and sometimes we can't get back to where we wanted to go. So my encouragement is do something rather than nothing, right? It is not meant to be a treatment. It is meant to be an aid. It is affordable. It's easy and local. Okay? So do something. But ultimately, it's your decision how you want to treat your own health care. That should be your conversation with all your doctors, including me, that's not something I want to do right now. And that's okay. Okay? Great. Well, that's all I have. Thank you, guys. I am so open for questions, and I got to stay in the spot. That light keeps reminding me.
What do you charge for a hearing test?
That is a fabulous question. In the past, when I worked on the East Coast, Medicare we would bill Medicare, and they would pay us for the test and the consult and the questions, an hour. They would pay us $45. That is now down to like 41 and 22 cents or something. So honestly, I don't bill Medicare anymore. It takes more of my time to send to my staff for them to bill, make a correction, Medicare, blah, blah, blah. I don't even bill them, right? Sometimes I do bill for office visit fees to your regular insurance, that's true. But for those of you at Horizon House, you may come and see me at any time, and I offer my on-site consult and my exam complimentary to get you started. Now, whether or not I'm doing a full exam for my own benefit or something that you want to take to somebody, that's something we'll talk about. But typically, if you're just curious, I'm doing a screening. If we start talking about hearing aids between us, I'm doing my full exam. Does that help you? I do. Yeah. Most all of my patients are Medicare patients. Yeah. Most all of my patients are Medicare patients.
Can you comment on earbuds and headphones?
With damaging your ears?
Yes. Yeah, sorry.
Yeah. It can happen. The question was earbuds and headphones, and can it damage our hearing? Absolutely. So the big rule of thumb is if an area is too loud for you to hear conversation in, you should wear ear protection, right? Conversely, with the earbuds, like on an airplane, or you're walking outside with traffic, and you're wanting to mute the traffic and mud it out with earbuds, we usually turn that volume up too loud. So in those instances, I tell people it's better to use a muff to block out the sound a little bit first and then monitor your volume as opposed to a loose bud. But you can damage your hearing by turning that up too much, and it's usually like a jogger is turning up their buds because they don't want to hear traffic, or someone on an airplane doing it too much, something like that. That answer your question? Second mic. You could ask it, I could repeat it.
A short time ago, I read something about a German invention around hearing aids. Never would they answer questions about cost, but the design was fascinating to me because it sounded like it was, their company was all lowercase, HEAR.com. hearingaids.com.
Ah,
Okay. You know, and so
it's a
they
website. It's not a hearing aid company. It's a website that sells hearing aids. They're not a manufacturer.
Oh, okay. Thank you.
Mm-hmm.
Thank
Yeah.
you.
I'm glad you remember the name of it. Yeah.
So I went on too and went through the whole process. I even scheduled an appointment with a local here, and I just was not comfortable with the way they were doing everything, so I withdrew. But it sounds like it could be a wonderful product.
What are you speaking of? The local person you were talking to?
No, the hearing aid they were advertising at here.com.
Okay.
The two German men that built this really small, high-tech
Yeah.
hearing aid.
See,
And it was 5,000 to 6,000.
yeah, Siemens, which sold, their hearing division is now called Signia, which if I were to go
Oh, yes.
backwards and go to
Yes,
those.
I know. I wondered if that was.
If you
Yeah.
want to know something about real hearing aids, go to any of these websites. They're the ones that have been in the division, been in the industry for decades. They're the ones that are going to spend the most on research and design and help you understand a little bit more on real hearing aids. And I'm sure I'm offending somebody by calling it real, and the FDA's got hearing aids over the market. I apologize about that. I'm old, but I say companies that have dedicated their life to build a product that's to help and treat hearing loss, right? That's scrutinized for decades about what they're building, and trying to make products that are healthcare product.
A lot of people go to Costco. What kind of product do they offer?
I'll still say something is better than nothing. Nothing against Costco. They used to use some of these offshoots. They had some offshoots of these companies. I believe GN Resound was the last one, and GN Resound pulled it from Costco. That's kind of not disclosed as to why. Costco might have been hammering them for pricing. I don't know. They are using the Jabra predominantly, which goes up to, I think, to $1,900. Jabra has been a company around for a long time that made earbuds. So
it's more an amplifier than.
I shudder to answer because I haven't had my hands on it. I do know one of the providers at the local Costco. I respect her as a person, I would say. I can't answer that question. How about that?
Is an audiologist trained to handle other things with the ear besides hearing?
Yes, as an audiologist trained to do other things with the ear besides hearing. So easy training, earwax removal, right? Further training, tinnitus, a little more complicated. Deeper training, diagnosis of disease, which really I suggest that when I send your referral to the doctor, but I'm not supposed to diagnose necessarily. Treatments of balance disorders, treatment of abnormal growth of sound, sounds too loud. We monitor brain waves during surgery. Does that answer your question? And dizziness, balance and dizziness. Am I trained? Yes. Is it part of my practice? No. I would, or I could have to refer you to first your primary and then give you some audiology and physical therapy individuals that do a great job with balance and dizziness. Mm-hmm. Yes, over here. Green.
Do you ever see the possibility of having waterproof hearing aids?
We have it.
What?
Yes. Well, let me back up. I used to work with children, and we did have waterproof hearing aids, and they were huge. Huge. So it didn't have a big market to sell and create. So, and then I got out of pediatrics. So I don't know how long that sustained or who carried a product like that. I will say Starkey's new product that came out the beginning and middle of last year, I physically dropped it in a cup of water and pulled it out, and it still worked. So they say it's waterproof. I'm very nervous to tell you that. I say it's really water resistant. But, yeah. And if you want more information, let's write your name down, and I'll keep looking at that. But Starkey does have that as part of their promo, part of their marketing. In the back, yes.
Two things. One is that some years ago, I got from the I don't even know where I got it, but it was free.
Okay, there we go.
And I mean, it would be free if I couldn't afford it. If I could afford it, I think I paid $100 for it.
Okay.
But it sits on my desk, and I can turn it up quite loud, and it also provides clarity. And I got this through the
Mail or internet or something?
Pardon?
The mail or the internet, you got it? You ordered it?
No, I didn't get it through the internet.
Oh, no,
No. This is from it was under the auspices of our.
It sounds like, Jeannie, maybe she's mentioning a table mic.
Pardon?
You might be talking about a table mic. I'm still not quite sure what you're telling me, but it sounds like it might be a table mic where it's something you put in the table or by your television.
Yeah.
And are you putting an earbud in your ear?
No.
So.
I can just turn it up as far as I want.
Okay. And what's the stimulus? What is it playing? A radio, or is it playing your TV?
No, it's sitting on my desk, and I'm talking to somebody over the phone.
Okay, so there we go. We're talking over the phone. Okay.
Yeah.
So, yes, there are amplified phones like that, or different gadgets that we can use and I brought some from CapTel, too, that type the words, that amplify telephone calls. And those are quite useful. Absolutely. Absolutely. Yeah. Now, I'll tell you, if you're having trouble hearing on the phone, you probably have some hearing loss.
Well, of course I have hearing loss.
Okay, there we go.
I've known that for a long time.
All right.
Unfortunately. But, and so, but this was free.
Yeah.
If you couldn't afford it. And I don't think they've included, as far as last time I inquired,
well, maybe
they had not improved it.
Right.
So.
Maybe you were talking, and there's another company that does this, but Caption Call is a company that I brought some flyers for, and I work with them, too, to sign off on you getting free caption phones. Some of you have already gotten them from me, so.
Okay.
Great comment. Thank you. Yes, sir. Oh, let me go over here. Way over here.
Okay. Is hearing loss hereditary?
Is hearing loss hereditary? It does run in the family genetically. Yes, sometimes it can skip, but commonly when you have some hearing loss that's in with your siblings, you're going to have some as well. And, again, once we hit that 50 mark, we're probably all going to, I have some. So.
One of the issues we've run into is the complexity of the device, and it's hard to use because you switch it from one thing to another, etc.
The complexity of the device, and you referring to real hearing aids? You referring to my hearing aids? You're referring to OTCs?
Prescription.
Prescription devices are complex. Okay. great question. It's a hot button for me. Ideally, and there's a reason why these manufacturers spend so much money on these hearing aids that make them cost so much for us and cost so much for you, is that we're trying to emulate your ear. Now, secretly, I feel like the eye is more complex than the ear, but it's complicated. And there are different issues with life that cause it to be more complicated or less complicated, and no one hearing loss is the same. So, my hot button is that I want you to have the most automatic hearing aid we can create. I want it to be something you put on and leave alone. That's my ideal. Now, if your lifestyle is such that you go boating and golfing and you come in here and you can't hear and you're in a group of noisy kids or whatever and you have different listening environments that I'm not accommodating for, I'm going to give you something to do about it. Maybe you change your program, right? I said at the beginning, I think to Jeannie, that hearing aids are hearing aids. Leave the gadget of the phone over here. They don't have to be together. Now, granted, with OTC stuff, a lot of that is true, but hearing aids are hearing aids without the phone. Can I connect them? Yeah. And does it make hearing on the phone better? Hugely. Right? But they are separate. Does that answer your question? They are complicated, and I think that's also why we have to have support. I can, sometimes explain things many times, and maybe we missed it, and we have to come back to it and learn it. Thank you.
Yeah, I've been saying tinnitus. You say tinnitus.
Tomato.
Yeah, right. So what is the research on that? I mean, I have it all the time. When I have my hearing aids on and I go to something like this, it's not there because there's other sound going.
Yeah. And ideally, that's commonly the way we treat it, is with masking it somehow with other stimulation. She asked a question about tinnitus, tomato. It is something we still haven't figured out in the industry. It can be complicated. It can be music. It can be a buzz. It can be a hiss. It can be a ring. Tinnitus in its definition is constant. It's not the random sounds that we hear of ringing, and it's a constant sound. That's the definition. But the treatment of it has eluded us. I come from a naturopathic background. I believe in all the treatments, from acupuncture to zinc and ginkgo and trying things like that. But the largest success with treating tinnitus is hearing aids. 50% of the people report relief. And then since they now have maskers inside of them, we now have about another 25% success of reducing the annoyance of the tinnitus. What is it? It's, again, that phenomenon inside our head. We don't really know how we pinpoint it. Is it on the cochlea? Is it further in on the auditory nerve? Is it a cortex thing? Where is it? What is it? Why? Right. But it commonly comes with hearing loss, commonly around noise exposure as well. You know, loud sounds make your ears ring. But it has to do with the damage of the hair cells, I think. That's my opinion. And then masking it with hearing better, or hearing what you should hear, does help it. That's why it's worse at night when you lay down and you're tired. Other things make it bad too, like wine, fatigue, stress, caffeine, things like that. Great questions, guys. I'll take a couple more. One back here.
Oh,
Yes? Can you just say it and I'll repeat it? Do prescription hearing aids need to be replaced periodically? Yes. Unlike some of your insurances that say you can get hearing aids every year, you should ask yourself, why is my insurance saying that? And it's because they own their own company that pays themselves. But I like to say 4 to 6 years. 5 years has kind of been a golden standard to say when people replace them. We replace them for 3 reasons. Number 1, because maybe your hearing loss outgrows what you have. Number 2, they have multiple repairs because you're wearing them 14, 15 hours a day in a waxy environment. And 3, because you just want better technology. You want the new stuff that's doing something better for you. So those 3 reasons is why I like to replace. In general, around 5 years is a good time frame. Not mandatory. We can still program them and change them, right? And that also affects kind of what I recommend sometimes too. I think longevity is better than price for a short term. That's not maybe my patient's opinion. Sometimes it is, sometimes it isn't. But I like, hey, let's just get a really good product. It's going to last us 5, 6, 7 years. All right? Nancy.
Oh, yes.
Hi.
I have to admit that I'm one of Jo's wonderful patients. I'm on my 2nd round of hearing aids from her. Yes, I have terrific tinnitus, but it's not there during the day. But it'll sure keep me awake at night. If I could just sleep in these things, I would love it. She has come and picked up my hearing aids at several times, fixed them, brought them back the next morning. I get just about everything I need from this woman, and she's kept me in great hearing. And I'm not the shill in the audience either. But I just, you've been wonderful for me.
Oh, thank you, Nancy.
Thank you.
Been a long time. Nancy and I have known each other since we just talked about it, like 2007 or 8 or 9, maybe 09.
You fit me, I think, 2009.
Okay.
You'd have to check your records.
Yeah.
Yeah.
I will. That's a pretty good track record, though. 09 to 24. How many years is that?
Yeah, this is my
15?
2nd pair.
And only had 2.
Yeah.
That's pretty good of me.
I think so. I like them.
Thank you, Nancy. That's very kind. Oh,
Yes,
we
so
talked about that, yeah.
You and I talked about it, but we didn't say it out
Yeah.
loud here.
So appointments can be made for us here at the clinic. We meet at the little room off jet of the beauty salon. And it's the 1st and 3rd Fridays. It is specific times. I like to have a schedule. If you're a new patient and you do want to talk and have an exam, take 2 appointment spots. And the concierge, you can sign up there and tell Jess Garcia, is that right? That you need 2 spots, if we can figure that out. You can also call my office either way, and we share the schedule so we can see it. So thank you for asking that. Yes? Yes, ma'am?
I had hearing aids, and I had an audiologist maybe 5 years. And then I decided I went to Costco. And I have the Oticon, and Costco gave you an excellent service. And I hear much better, and it's tied to my cell phone. And it's been 10 times better than I had before.
Seattle Costco?
Yes.
Or Redmond or
No, Seattle.
And they gave you Oticon?
Oregon, yes.
I'm going to call my Oticon rep and see if that's true.
Well, I know it is.
Yeah.
I have it.
That's interesting. Yeah. They might be branching Costco might be branching out.
The service is excellent.
Yeah.
Much better than my audiologist.
And I think that is a very true statement in all of healthcare. You have to find the right person for you. I'm not the right person for everybody. And you have to find the right fit for you. My goal of being at retirement communities is that people get consistent service. And that consistency in hearing is a big part of all of those consequences being less and less. Alzheimer's and dementia, the dizziness, the falling, all of those things. So I pride myself in saying we have to be consistent with our hearing ability. Not all people can drive, I have hearing aids that are same price as Costco, so it's not like it's any different. I do have a different education, and I like to say that is a value. But yeah, you have to find the right provider for you. I'm not for everybody. All right? Hey, guys, thank you so much. I appreciate it, and I look forward to coming back.
Thank you so much for coming.